Testosterone replacement therapy is often pitched as a cure-all for low energy, mood, and libido. But what doctors may not highlight is that up to 90% of men on it face a massive drop in fertility. Beyond that, TRT can literally thicken your blood, elevating the risk of serious cardiovascular events. And the medication's price is just the start. Hidden costs can add thousands to your annual bill. Here, we'll break down the true costs, options, and what to really expect for an informed decision. So, what does this therapy actually cost you? Let's move past the price of the vial and see the full financial picture. First, the mandatory costs, initial consults, and blood work. These add $800 to $1,500 a year before a single dose. Injections are the most affordable, at just $25 to $120 a month. The drawback is hormonal peaks and valleys. With all these fees, your delivery method drastically changes your total cost. So, which fits your budget and lifestyle? Injections are the most affordable, at just $20 to $100 a month. The drawback is hormonal peaks and valleys. Topical gels provide more stable daily levels, but carry a risk of accidental transfer to family through skin contact. Pellets are the set-it-and-forget-it option, lasting 3 to 6 months, but run $1,200 to $2,500 for one insertion. Surprisingly, a study found 66% of men prefer self-injecting at home. The reason isn't just cost, it's about autonomy. This preference shows a key factor beyond pharmacology. Feeling in control of one's own treatment adds to satisfaction. So you've weighed the costs and chosen a method. But what is TRT actually doing inside your body? This is where the risks appear. As we said at the start, TRT shuts down your body's signal for sperm production, leading to a 90% chance of infertility. However, this isn't always permanent. You can bank sperm before therapy, or use meds like HCG to maintain function. Another major effect is polycythemia, where TRT stimulates red blood cells. This thickens your blood, raising clot risk. For older men, prostate health is a major concern. TRT is off-limits for active prostate cancer and requires PSA monitoring. An unexpected connection exists with sleep. TRT can worsen sleep apnea, while untreated sleep apnea also lowers testosterone. We've covered the body, but TRT's impact on the mind is just as profound and far more delicate. When your dose is dialed in correctly, TRT can be incredible for mental health, improving mood, and cognitive clarity. But here is the paradox. Too much testosterone has the opposite effect. It can cause irritability and emotional turbulence. This is not a temporary fix. For most men with diagnosed hypogonadism, TRT is a lifelong commitment. Stopping means symptoms return. This means you must be proactive. Managing side effects like elevated estrogen is not optional, requiring attention to dosage. With all these risks, costs, and details, how do you actually make TRT work for you and get the benefits? Success starts by connecting the dots. The peaks and valleys of injections link directly to the mental health paradox. Recall the hidden cost of ancillary meds? That's directly tied to estrogen management. This is a financial choice you must plan for. TRT is not a substitute for a healthy lifestyle. It's a tool that works with it. Sleep, nutrition, and exercise are mandatory. The single factor that ties all this together, cost, risks, benefits, is monitoring. Regular blood testing is non-negotiable. The decision to start TRT is a series of trade-offs: cost versus convenience, and powerful benefits versus significant risks. Handling this requires you to be an informed patient. You need to understand the costs and outcomes before you begin. TRT can be a powerful therapy when managed intelligently and proactively with a qualified medical professional. Discuss these specific points: fertility, blood work, hidden costs, and estrogen management with your doctor. Subscribe for more in-depth health analysis that empowers you to make better decisions about your own health.